How are you?
Good.
Yeah, lots going on. Thank you for accommodating Thursday since tomorrow is Good Friday. I appreciate it.
We got to keep the tradition going.
Yeah, thank you. Well, the Premier just announced that all of Ontario is going to be in lockdown. What are your thoughts on that? And do you think that is enough based on the criteria of a lockdown?
Well, I shared on my social media today some of the commentary by Dr. Isaac Bogosh and Dr. Zane Chagla, who are both experts in infectious disease. And rather than a sweeping lockdown, what their advice is you need to focus vaccines on where there are significant community spread and outbreaks, which is Toronto and Peel. And you really need to deal with outbreaks we're having in essential workplaces. And so my frustration with this latest province-wide lockdown is all these essential workplaces are exempt. So the food processing plants, the transportation logistics plants that are an outbreak, this doesn't apply to them. So for me, I would have loved to see, listen, we're going to have vaccine priority for the hot spots. We're going to get the outbreaks under control, but that's not what this is about. And so I just feel that if we keep on taking the same approach and are frustrated with the results, well, we're going to keep on getting the same results if we're using the same tools. It's, we're not tackling the cycles of transmission.
So Dr. Bogosh is part of the vaccination task force, correct?
I believe he's on the national one.
National one, okay. So I mean, I guess, are we going to be in perpetual lockdown until June? I mean, like, what do you think? I mean, or May, or
It makes me want to pull my hair out because it's frustrating.
Yeah.
I struggle with this. This isn't just a health pandemic; it's an economic tidal wave. Our businesses have sacrificed and sacrificed and sacrificed, and it's tough. It's tough. And so, I'm going to go back to vaccines. This is about supply, and we need vaccines in Canada's hotspots. The analogy I've given numerous times is, if you're the fire chief and there's a fire, you're going to send the fire truck to the house that's on fire.
Yeah.
But the fact that we're sending vaccines around the province to areas that don't have outbreaks, and we're not getting enough vaccines in the area that we are an outbreak, doesn't add up. You send the fire truck to where the fire is, and that way it stops it from spreading. It's as simple as that. You protect the hot spots, you protect the rest of the province.
Is it time to close the non-essential warehouses like Amazon? I know, you've been screaming about sick pay, and it doesn't look like it's coming. So is it time to close down these non-essential warehouses?
So what I'd say is, if you want numbers to go down and you're closing everything except for the areas that are actually an outbreak and you're keeping them open, you're not going to get numbers down. If you wanted to get numbers down, you shut down these essential workplaces. Sure, it would be tough for a few weeks because you wouldn't have food in grocery stores. You may be short key supplies, but you'd see the numbers go down dramatically. I just feel this tinkering around the edges doesn't work. We've been in lockdown since November 23rd. Are numbers going down? No. Why? Because we're leaving the places open that are actually in outbreak.
Now, can Peel Public Health actually, do, maybe I'm using the wrong word, but the Section 22 order to vaccinate everybody at Amazon and all the super warehouses in Brampton?
No, the vaccine supply is provided by the Government of Canada to the provinces, and the provinces set the priority list.
Okay. Well, it sounds like the city of Brampton now is probably going to have to do more work in regards to enforcement because of the new rules, new lockdown rules. Are we going to see more enforcement starting this week for the next 28 days?
Listen, we have to abide by the provincial laws, but our approach in Brampton has been to educate before imposing fines. And, the public's been really good at abiding by the public health protocols and the provincial emergency laws. And by law will comply as they're legally obliged to.
Okay. In Saga, this morning, got a list of all the pharmacies that will be part of the vaccination pilot program in Brampton, Mississauga, and all over the southern GTA, southern Golden Horseshoe, actually. So it was 13 pharmacies that were listed in Brampton. Are you happy with that number, or should there have been more?
Listen, I'd love for every pharmacy in Brampton to be able to be providing vaccines. We're a hotspot. We need these fire extinguishers to deal with the outbreaks. And so I was livid 2 weeks ago when we weren't included into the pharmacy pilot rollout, and they amended it and told me not to worry, we'd be added quickly, which we were. But I'd love to see more pharmacies involved. I want us to focus on Canada's hotspots. It's spreading out. The fire grows out of control if you don't focus on where the fire actually is.
True. The feds are saying that the supply is there. So what's going on with the province distributing it to the public health?
The feds are wrong. The supply is not there. Canada's 55th in the world when it comes to vaccine supply. They've done a miserable job on procurement. You look in the U.S. where they're vaccinating 30-year-olds. We have the ability to do 70,000 vaccines a day in Peel region, and our best day ever was 8,000. On average, it's about 5,000 vaccines a day. We've got a capacity to do 70,000. We're not even touching a fraction of our capacity. So any politician in Ottawa that says supply is enough, they're misleading. And I'm on the ground. I see the vaccine infrastructure. I work with public health every day. And so when I hear these competing press releases from Queen's Park and the House of Commons, when it's BS, I'm going to call BS. We have a supply problem. Supply. That's the greatest challenge in Canada. And you want to protect our residents, get us supply. We'll get them into people's arms. We've got the capacity to do it. And frankly, we've had the capacity to do it now for 3 months. And this fight we're in with variants right now, we wouldn't be in this fight with variants if we had had the vaccine supply that the U.S. had three months ago. We're behind the 8 ball on this. If you look at the vaccine supply per capita and look at other countries, Canada shouldn't be 55th in the world. Give me a break. Yeah,
you're right. Let me ask you, I'm sure you hear it from all sides. I mean, what do you say when you hear the vaccine hesitancy? Like when they say, I'm not going to take it? Like, what do you say to them?
Vaccine saves lives. And, I'm not a physician, but the best infectious disease doctors in our country say this protects you, say that this is integral to public safety. And I trust our physicians. And I'll just tell you, from a personal perspective, I'm waiting for my turn in the queue. I'm 42, and I would never jump ahead of my turn in the queue. But when it's my turn, I'm going to get a vaccine. I believe that's in the best interest of my own health. And I can tell you that my parents had their vaccine, no issues. My grandmother, she's 106 right now, turning 107 in May. She was vaccinated in her long-term care center several months ago. And not only did I support her being vaccinated, I was so relieved when she was vaccinated because that means protection.
True. Are you going to do it in a public setting, in front of TV, Instagram Live and stuff?
Whatever public health wants me to do, if I can help with showing confidence in vaccines, I'm happy to do so.
Okay. April break. Do you think the school April break will be extended past the week?
Right now, we're hearing that it's not going to be, but these days everything has been in flux.
Okay. According to the City of Brampton website, 24 bus drivers have been tested positive for COVID-19 this year so far, and unfortunately, one has passed away. What are your thoughts on fixing this to get them more safe?
Well, our transit operators should be vaccinated. This is a problem with a lack of vaccine supply. You got people on the front lines that aren't being vaccinated. So when I hear officials in Ottawa say there's no supply issue, our food processing plant employees, our transportation logistics plant employees, our bus drivers, our bylaw officers, our educators are all eagerly asking to be vaccinated. We don't have vaccines. And so this is an example. If that transit operator had been vaccinated, maybe he'd be alive. And I have to see these updates every day when a city employee tests positive. And I see that, and it's a consequence of that protection, these vaccines not being available to people that are on the front lines.
I'm going to get to some viewer questions here. Turf football field, 10 people at a time. I think David Suzuki. How does, an Apple store have up to 50 people on it, but the turf football field allows only 10?
So I had argued that we should be able to have the restrictions lifted on outdoor amenities. The physicians have argued that these outdoor environments are very low risk. I agree with our physicians. And so I find this latest restrictions imposed by the province frustrating because I believe outdoor amenities are good for people's health. I think it's good for mental health and it's good for physical health. What are the consequences of people not being able to get exercise over a year?
Sure.
There's a adverse health impact in that.
Another question we have, did any COVID vaccines expire and go to waste in Peel?
I'm told that Peel's been very successful in not having wastage. Dr. Lowe says wastage has not been an issue in Peel region.
And I think here's a frustrated restaurateur. They allowed restaurants to put expensive tents to reopen, and now that we're up, there's going to be a huge loss. Can anybody recover that?
I agree. Outdoor patios are viewed by public health as safe environments. I don't agree with the fact that our patios are being closed. This is a provincial call, a provincial emergency protocol. It's one that I don't support.
Will PPE grants be extended past March 31st?
I'm not sure.
That might be provincial.
Yeah, that might be. I'm not sure if that's a provincial or federal fund, but maybe that's a question we can ask the appropriate representative.
Okay, those are all the questions I have, Mayor Brown. If you can do me one little favor, my grandmother actually turns 101 this Sunday, if you can believe that. So, can you say happy birthday to her? She watches CP24 all the time, right? And
What's her name?
Her name's Lola.
Lola, happy 101 birthday. I hope you know you're a spring chicken compared to my grandmother. So you've got lots of great years ahead. And hope you stay safe and healthy.
Awesome. Mayor Brown, thank you so much.
Thank you.
Made her day. I'll put that in the video collage that I'm making. So,
Awesome.
All right. Okay.
Thank
Have a good
you.
weekend. Take care.